Betty was highly intelligent, down home, common sense, did not tolerate anything but a very high work ethic and standards.
The things that she was passionate about, she was no nonsense. She was passionate about children. She was passionate about Children's Hospital and her family.
She was fierce in her devotion to her patients, fierce in her defense of Children's Hospital and her promotion of pediatric health in Arkansas, and she was a force to be reckoned with. In fact, she and her two sisters were all forces to be reckoned with.
She was a caring person. She loved children. I don't know how many times when my children, her niece and nephews, would be ill and we'd go to see Dr. Betty, or Aunt Bet as they called her. She would say to me, "Now, you don't need to be in this room. I'm going to talk to these kids." And that was kind of one of her mantras, that she wanted to develop a relationship with the children she was working with, no matter how young.
Betty really focused with all trainees and medical students and nursing students that being at the bedside, being with the patient, is the greatest learning experience you can have.
She loved to educate anywhere, anytime, to anybody. She was a huge educator.
I think Betty's calling, I think she would call it a calling to be a physician, and then specifically a pediatrician, probably started with her upbringing in rural Arkansas, very family-oriented, very education-oriented, but very focused around children. The CEO of Children's recruited Betty because I think they saw a true leader. They recruited her with the help of Tom Bruce, who happened to be the dean at the time. They all became incredible friends, and that team of people, and then subsequently followed by Dr. Jonathan Bates as the CEO, that was the true big build of Arkansas Children's Hospital that took it from a few beds to several hundred beds, that took subspecialties in all areas, that took the access that kids could have for neonatal intensive care unit, cardiac surgery, cancer care.
She really did come to Children's and absolutely change, the face of Children's and the respectability and kind of put it on the map.
Betty's dream and advocacy was that that hospital and that system statewide, populated by pediatricians that she helped train, would help the kids of Arkansas.
Betty always thought that Arkansas always got a bad rap, and that really bothered her. And she thought Arkansas is just as good as any other state. She just was such an advocate for children, but she wanted every child in Arkansas to have the same access no matter where they lived, who their parents were, and she thought Arkansas Children's Hospital would be able to provide as good a care as any place on the planet. She got on all kinds of boards, she went to Washington, she did all these things that kind of got Children's Hospital and the state of Arkansas kind of out there for people to take notice of.
That was Betty's dream. She wanted no child to have to leave Arkansas to get the care they needed. She was on the Clinton Task Force for Healthcare Reform during his presidency. She was the president of the American Academy of Pediatrics, the only Arkansan and the second woman to lead the national group of pediatricians, the American Academy of Pediatrics. Her community service, she was one of the founders of Arkansas Advocates for Families and Children.
Betty was a true Renaissance woman. She just broke all the stereotypes. She could stand toe-to-toe with anybody in the country.
She loved children, she loved people, she loved dogs. She loved teaching and fishing, the outdoors, and taking her nieces and nephews fishing, that sort of thing with her. She loved Lake Ouachita, that's where she went to relax and get away from all of the trials and tribulations.
She never had kids, so all of her nieces and nephews were kind of her kids, and she was very proud of us, and she always wanted the best for us, but she also liked to try to guide us a little.
People need to understand how much receiving the Tom Bruce Award would have meant to Betty Lowe.
She and Tom Bruce were in medical school at the University of Arkansas at the same time.
She and Tom Bruce were great friends and great colleagues, and they did lots of things together. She was a legend in Texarkana, and she was a legend in Little Rock.
As President Clinton said when he was at her retirement party, her dream in life was to see that all the children of Arkansas had the opportunity to health care that would allow them to reach the dreams of their life later.
As a pediatrician in training, I benefited from the knowledge, the dedication, and commitment of Dr. Betty Lowe to the kids of Arkansas. I'm honored to bestow upon her, on behalf of our ACHI Health Policy Board, the Dr. Tom Bruce Arkansas Health Impact Award.